Good morning, I'm Sunetra Choudhury, National Political Editor of Hindustan Times, bringing you the best stories on Tuesday, April 14. First, a look at the numbers. India has now crossed the 10,000 mark. In fact, the total number of infections stands at 10,444 and 355 people have died, which brings me to our top story. We look at how we stand vis-a-vis the spread of the disease across the country. Well, the good news first, our rise in cases hasn't been as steep as other countries like the United States. The bad news, it has been steadily rising. There's not been any stop to that, which means that the number of cases doubling has been every 4 to 5 days, and there's been no stop to that. Even the number of deaths has been doubling every 4 to 5 days, and that is where authorities need to come in to do something, because they haven't been able to manage it like countries like South Korea and Japan, and that's the area of concern. And the area of concern is that it shouldn't be doubling every 3 days. Which brings me to my next story. What experts have said, the only way to tackle this is aggressive testing. That's how South Korea and Germany have done it as well. And India has cleared the import of antibody tests from China. In fact, they've ordered 4.5 to 5 million of those antibody kits. The question is, and what our story says, is that the date of delivery is going on getting delayed. It was meant to be delivered on the 5th of April, then the 10th of April. Now the new date that they're saying is 15th of April. When various people asked the ministry, ICMR said that they couldn't comment on whether our shipment had been diverted to other countries like United States. Remember, this is a priced commodity, and various countries are now vying to get these antibody test kits. India has, of course, tried to indigenously produce them, and that production is going to start. But till then, we're waiting for those test kits from China to come in. The next story that we have for you is, in the absence of a cure for Covid-19, what are doctors doing to treat the patients who've been admitted? Well, they've told us that the treatment that they're using right now is hydroxychloroquine and azithromycin. Remember, HCQ, hydroxychloroquine, is what President Donald Trump has called the wonder drug, even though scientists say that it has a patchy record. Well, doctors have told Hindustan Times that it has had no adverse reactions. They feel it is helping patients. And so if you want to know more details about how doctors are using it, you can read it in our paper or on the website. The next story that we have for you is something quite contentious and related. It's not directly COVID-19 news, but we've seen in the last few days opposition parties demand that the entire Central Vista, or the redevelopment of New Delhi plan, be shelved for now because they feel it's too expensive, and the money should be spent in revitalizing the economy after the pandemic has really brought the economy to a halt. Well, we have the new plan. Environmental clearances were stopped for the redevelopment of the new parliament, and before it cost 770 odd crores. Well, the new plan says that the cost for redoing parliament is going to be even more expensive. In fact, central government has said it's going to cost upwards of 920 crores. Remember, all opposition parties have said it, so we have to wait and see whether the government gives a green light to redoing new parliament building. And finally, Andrea Bocelli, opera singer, had a solo concert at the Duomo in Milan. We've seen ever since the disease has struck how music has brought people together, whether it's them singing outside their balconies, or whether it is just artists performing from their homes and transporting it live via the internet. Well, this music was enjoyed by millions on Easter. That's it for today. If you want to keep tracking all the news updates, remember, go to hindustantimes.com.